The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children.
It's time to talk tonsils. Yes, indeed. Tonsillectomy, long been a procedure performed mostly on children, often to address recurring throat infections. But now a new study indicates there might be a reason to forego the surgery, the possibility of an increased risk of future illness. Joining now to discuss is otolaryngologist and the author of the book Hype, Dr. Nina Shapiro.
Welcome back.
Welcome, Doc.
Well, when we saw this topic, I know I personally got excited because, you know, I have background at ear, nose, and throat, but to discuss this topic, we decided we need to bring you in to join. So what did you think?
Near and dear to my heart.
And everyone pay attention to this, because as medicine changes and evolves and new studies come to the forefront, these are things to pay attention to, because you might be out there right now as a parent having to make a decision like this. So you two together can tag team on this.
And we will.
Yeah.
Yes.
In fact, the number of tonsillectomies is half the number per year. It was 1 million per year.
Right.
Back when I trained in the early 80s, obviously number one operation, I think overall number one in kids. We've cut that in half, and we're going to get into some of those reasons why.
Right. So tonsils and adenoids, first of all, are these structures in the back of the mouth, in the back of the nose. They're part of the immune system. And a lot of people think, oh, well, we don't want to take them out because we're taking away that first line of defense. And that's actually not the case. The majority of the kids who are getting their tonsils out are for breathing problems, snoring, sleep apnea. And those are not things you want to wait on, even in this young population. So it's a real
We've
problem.
learned so much more back in my day, and yes, I had my tonsils out when I was 5 years old, like clockwork. I remember that general anesthetic ether. It was, I remember eating a lot of ice cream, but I remember that experience well, and that's the way it was done. 5 years old was sort of, I had multiple recurrent middle ear infections back in the day, and they removed my tonsils, and guess what? I didn't get sore throats, and those middle ear infections did stop.
But it sounds like this study
is an interesting study, actually, because I'm curious as to your thoughts, because I know they looked at a Danish database of 1.2 million kids. Yeah, they did a comparison between kids who never had their tonsils out and then kids who did tonsils and adenoids up to the age of 10. So they tracked them for a good 10 years. And my understanding was that they found that people who had the tonsils out had 3 times the rate of allergies and upper respiratory infections, and adenoids out was 2 times the rate. So those are pretty startling findings, and I'm curious, since obviously this is a common procedure, how you think this actually plays out.
It was a great study. It was a huge study. Again, they looked at over 1 million kids, and they followed them actually until they were 30. But what they found was, yes, there was some slight increase in these other respiratory problems. But the main issue with this very good study was it was observational. So they were looking back, and it was sort of what we call a reverse causation. So who were these kids that got their tonsils out to begin with? They were probably kids who had
underlying
problems, asthma, ear infections, So they had problems. They probably would have had problems anyway. So it's it's the equivalent of saying, well, people who have knee surgery are going to have joint problems later on in life. Well, why were they having knee surgery to begin with? So that's the main flaw of the study. I think it is important that parents need to understand that there are risks to this surgery, and short-term and long-term, and they need to discuss it with their doctors. But it's not necessarily that if you have the tonsils out, you will be sick later in life. It's not a cause and effect.
That's not true. And you talked about this Waldeyer's ring. We had that whole system of this lymphoid tissue.
Right.
You remove your adenoids and your tonsils, there's still other parts of that system, lingual tonsils, you have your lateral bands, all these other things, and we're talking shop here now. So you are not just totally eliminating that function. And to your point, okay, maybe the criteria are very strict now for when you have your tonsils out in terms of recurrent sore throats. That was a big deal in the past. If you hit this number, proven strep throat infections, then you're a candidate for tonsillectomy. I mean, that's still in place to a certain degree, but what you touched on, we know so much more about sleep issues and breathing issues. If you're a mouth breather, as leads to other problems with a long fascia
growth,
and change your occlusion. So some real reasons in selected patients why you would still want to do this.